Ever wish you had a magic wand to make your patient's pain disappear? Let us show you the next best thing. Microcurrent works by attacking pain at its source by promoting cellular repair. Nothing works better or is more complete. Monad developed the technique of working with muscles by stimulating the Golgi tendon organ of the muscle. Nothing works faster or better to tonify or relax a muscle. The first Menzomatic was developed as the ultimate electroacupuncture device, both in terms of locating and in treating. The current Menzomatic still carries on that tradition. Monad developed the first protocols for facial rejuvenation utilizing microcurrent stimulation. Those original protocols are still the best today. Monad microcurrent devices have been treating professional and world-class athletes since the 1980s. We don't think any other machine has treated more Olympic, professional, college, and high school athletes than the Menzomatic. The Menzomatic can deliver its treating current through either attended probe use or unattended pad use for different billing options. Monad developed a special technique to work at the cellular level to enhance tissue repair. Monad has developed a special technique to allow the operator's hands to become active electrodes, allowing for a dynamic microcurrent massage technique to be delivered. Monad, makers of the Menzomatic, patented the first clinical microcurrent stimulator in 1978. For 30 years they have been in the forefront of equipment and technique development. Before we explore that, let's discuss the unique nature of microcurrent stimulation and its effect on the body. The energy delivered by a clinical microcurrent stimulator is so small it would take 1,000,000 machines to power a 40-watt light bulb. But in the case of the human body, less is more. It is exactly this type of small electrical current that runs the body. Several researchers discovered the body develops a current of injury that can interfere with the healing process. It can be the cause of pain, trigger points, and a slowdown of healing. Passing a similar but polar opposite current through the area can reverse the current of injury. All the original research that determined ATP production and cellular repair could be influenced was done with microcurrent electrical nerve stimulation, or MENS, not with lasers. No other electrical modality can talk to the body at the cellular level like microcurrent stimulation. But be warned, not all microcurrent stimulators are created equal. Here's what is necessary to be considered a true clinical unit. It must be a constant current generator. Just like the title suggests, your unit must have a circuit that guarantees the current setting is actually being delivered. Many cheap units are constant voltage, and that is just not good enough for clinical use. The unit must have plus or minus 60 volts. Skin resistance is about 10,000 ohms. If you are trying to deliver 600 microamps through the skin, you need a unit that has enough available voltage. Some cheap units have 24 volts or even less, which creates quite a problem for the circuit to deliver the desired current. The unit must have a 50% duty cycle and frequencies below 1. A 50% duty cycle means the current is actually on for 1/2 the time. If the hertz is 1, the current is delivered for 1/2 second. If the hertz is 0.1, the current is delivered as a direct DC current for 5 seconds. Many cheap units have duty cycles measured in milliseconds rather than seconds. The unit must have an alternating polarity every 2.5 seconds. This is Monad's patented tsunami wave. Monad discovered that treating the area for 2.5 seconds with a negative pulse enhanced the body's reception of the next positive wave. This discovery was so unique, a U.S. patent was granted. It is absolutely critical that your unit have a current feedback loop. Microcurrent stimulation is subsensory. Your unit must have a feedback loop that shows conductivity and the amount of current actually being delivered. Microcurrent is great for treating acupuncture and trigger points. Your unit should have an accurate meter to locate points and ideally a circuit to show when the point has been treated. A tour of the Menzomatic shows us first that we have 2 channels of stimulation, channel A and channel B. These 2 channels are completely isolated and are independently controlled. Now the current can be delivered either through electrodes and pads or through a probe with the patented Q-tip applicators. Each channel has its own control over frequency and current, and also the polarity and the wave slope. And it's very easy to adjust the frequency by flipping the multiplier switch so that you can have frequencies anywhere from 0.1 to 900. The unit also comes with a timer that can time the treatment in seconds and also in minutes, as well as a continuous mode. It has a speaker that will let you hear the different treatment tones that will tell you the polarity and the conductivity. And at the very top of the screen is a very special meter that when you're measuring acupuncture points will give you a range of 0 to 100 or 0 to 200 depending on your preference. During treatment, it will also let you know the percentage of conductance and the percentage of the current that's delivered. Remember that the Menzomatic is a constant current generator, and it will do everything that it can to make sure that the current output that you select is what is actually being delivered. And at the very top of the case is an opening for a very deep cavity that will hold all of the accessories and wet Q-tips and electrodes, so that everything is nice and tightly packed in this unit. Think of it as a 21st century doctor's black bag in white. As you search for the point, you can hear the meter tone rise and fall. The higher the sound, the closer you are to the acupoint, and you can see the bar graph will advance. Once treatment is begun, the meter then shows the level of power output, and you can hear changes in the polarity. When the treatment is finished, you hear a very special audio signal that will rise very rapidly and then fall. That lets you know that treatment has been accomplished for that point. Hi, I'm Dr. Joe Ventura, and I'd like to thank you for watching this presentation. In my clinical practice, I've used virtually every type of physical modality to help relieve my patients' pain and to improve their muscle function. As a developer and registered manufacturer of medical devices, I've designed and built about any kind of device that has electrodes or probes coming out of it. By far, my favorite device is a clinical microcurrent machine because it works at a natural level. Rather than trying to mask a person's pain, it works at the cellular level to speed up healing and make the healing more complete. I've never seen a type of device that works as well as clinical microcurrent. I would sincerely hope that you take a serious consideration at making a true clinical microcurrent device your next practice purchase. Thanks again.